Well, a key piece of President Obama's health care law is running out of money. The program was set up in 2010 to help tens of thousands of Americans who have pre-existing medical conditions secure insurance until the full health care law kicks in next year. It was sort of a bridge to help them. But on Friday, the administration announced that that program will no longer be accepting patients soon because it's out of money. Lou Dobbs is host of Lou Dobbs Tonight on the Fox Business Network. And that's just the latest headline. As you look through the headlines on Obamacare today, Lou, it's disturbing. They're talking about the Washington Post. Will young adults face rate shock because of the health care? Saying their rates they could go up as much as double. They could double. Or at least 50% they could go up. That now half of the states in the union have rejected participation in the so-called state-run exchanges. You know, it's supposed to be like the online Expedia, where you say, okay, this is how old I am, this is my medical background, which exchange should I purchase my insurance on? Half the states have said, we're not doing that. So now the feds have to do it, which the feds did not budget enough money for. And now, on top of all that, we find out that the high-risk pools had way more people than expected. Yep. They can't fund it. They've run out of money. And that doesn't necessarily portend good things for when we have all of the people with pre-existing conditions trying to get coverage in 2014.
Exactly. And it goes into effect January 1st, 2014. It seems like it just was yesterday.
It's 11 months away.
Talking
less than.
Here's the funny thing. As I looked over some of these state exchanges they're called, to set up health care coverage.
Like the Expedia thing.
Right,
like, okay,
exactly.
I'm this age, I'm this background.
Well, they don't
the
have anyone
I
from
think
Expedia, unfortunately, working on it, because as I looked at each one of these sites and some of their information pages, Megan, you could not imagine how obtuse, how just opaque the entire process. It is a disaster. It's early days, sure.
It's not that early.
No, it isn't. It isn't. I was trying to be nice about it. They're in a heck of a mess, whether they're the states running it, whether the federal government will be running it. 25
because
states.
Because those are supposed to be set up by October 1st.
Yeah, exactly.
So they don't really have 10 months on that.
People are supposed to be signing up then, and as far as I'm aware, there's not a single state even close to being ready to go to work. You talked about young people in this. These are the people, this is the genius of Obamacare. Because young people, because they're typically healthy and hearty, they don't buy insurance, so they stay out of the system.
Or if they get any, they get sort of the catastrophe coverage, that's it.
And so the genius of Obamacare, as Obama said himself, is that he's going to hit young people with it. And
that's how they have to fund it, because they had to lower the premiums on the old people. The law says you can no longer charge old people any more than 3 times what the young people are being charged, which sounds great if you're an older American. But if you're a younger American, you may be in for a surprise when you see your premiums.
And the truth is, the older American is taken care of under Medicare, Medicaid for those who can't afford, who are in poverty. And now young people are being treated the same way. They're going to be hit. What
are they going to do? But let me ask, what are they going to do? So when the young people see that their premiums are about to skyrocket, as the Washington Post is saying, possibly more than double, and these are young and healthy people who barely wanted the insurance in the first place. So then they say, forget this, I'm not going to have the policy.
What government does.
But they have to.
They're going to fine people, they're going to charge people, and guess what? They're going to do it by the tens of billions of dollars. That's what they're expecting.
Is that going to adequately fund the program? Because
Absolutely
they need these
not.
young people to fund Obamacare. They are
absolutely
critical.
Need them. They not only need them to fund it, we have 2 things happening. They're trying to put pressure on young working, young people, period. And at the same time, we've got the crush of people retiring, the baby boomers retiring through the next 10 to 15 years. And this is a demographic nightmare for the poorly thought out, poorly considered, poorly reasoned Obamacare. And right now it is such, as you, I think, elegantly put it, such a hot mess. Nobody wants to touch it. One thing they do know is if it does work, it's going to be a miracle. And if it doesn't work, Obamacare, or read President Obama, is going to be the one blamed here.
What about this pre-existing condition thing? So they had $5 billion allocated just for the bridge program.
Right.
They're running out of money. They're not going to have enough. They're cutting off the applications.
That's all the money that was appropriate.
Now now they've allowed about 100,000 people to get this coverage. All right. But now there's, what, 400,000 people estimated to still need pre-existing coverage. And what does this mean? Have we adequately funded Obamacare so when January 1, 2014 comes in, are those people going to get what was promised to them?
Let me do something I seldom do. Let me ask a question in response to yours. Has government ever adequately funded one of its programs, or does it always have to get bigger? in every instance, this thing is underfunded, poorly thought out, and a hot mess waiting to happen.
The headlines, they're not good. They haven't been good for a while. Lou, thanks for being here.
Great to be with you.